and welcome to Nurse Table Talk. Kathy and I are here today. Hey, Kathy.
Hi, Julie.
And we are here today to talk. Our topic is how to prevent a possible readmission to the hospital. And by the end of today's video, you'll be more informed on how to be more proactive and prevent a possible readmission. So starting off, Kathy, maybe you could give us the statistical rates on what you have found out.
Yeah, the reason that Julie and I found this to be a really important topic to conquer and really kind of discuss is that the rate of readmission is honestly over 35%.
Yeah, that's
So it's not like you just, I know, it's not like you just go and you come home and you're golden. There's a huge gap in there that we're going to try to talk about today so that you guys have an idea of what you need to do when you get home to avoid going back. So,
okay.
Julie?
So it's really important that while you're in the hospital, so we're going to go from that standpoint of while you're in the hospital, you want to inform your healthcare team of what your needs are when you're home. For an example, do you live alone or do you cook? I mean, these are just a couple of things that have come, that can come up. And one thing I do want to mention before I forget too is if it is a surgical procedure or any type of procedure, usually the physicians will want somebody to be there for 24 hours when you get home. And that doesn't mean leave at bedtime and come back in the morning. That means stay overnight. So I wanted to get that in there. But again, you want to assess what your needs are. Maybe are you able to use the bathroom?
Yeah, and it's not, and it's not the honeymoon phase. It's not in the best case scenario, can you get to the bathroom by yourself? It's how are you feeling your last couple of days of that admission? Are you feeling confident? Are you feeling able? Are you able to get up out of bed? Are you winded? People lose 20 to 30% of their baseline function every day they lay in that bed. And it doesn't matter if it's a rehab facility or a hospital, it's your body's stressed out, your brain is stressed out, you haven't slept, whistles, bells everywhere. And so a lot of times what we have seen in our work is that people have, they have best case scenario thinking, but not always is that the actual realistic picture.
Right. And again, so that person may not realize that they lost a lot of strength. So getting to the bathroom. Do you need help while you're in the bathroom? Do you need help bathing and showering? These are just things that, to kind of be mindful of so that when your healthcare team comes to do your discharge planning, that you can say, I'm not really certain that I might need some help. So those are just a few things. And also, Kathy, like if people they get home, we'll go from there now. I mean, just getting home. Do you need help understanding, setting up your medications and knowing what those medications are and when to take them, when not to take them, those kinds of things?
And discharge planning in the hospital is as good as it can be. Right. But what I have found as a bedside nurse and then working later in my career as being somebody who follows up with those people when they get home is that your brain isn't functioning completely. You're not you when you're in there. And so people can sit down with you and go over that paperwork over and over and over again. There is a high likelihood that you're going to get home and you won't even recall, you won't remember, something rings a bell, but you're not quite sure. Yes. And so these are things that come up over and over again. So we do know that there is a gap between the time somebody leaves and somebody gets home and then tries to pick up on their own. So
right. And always, and when you were speaking of discharge instructions, always there's usually phone numbers at the end of the discharge instructions on who to call. And while we're on the topic of discharge instructions, understanding them to the best of your ability, like you said, Kathy, if somebody's on pain medications, they might have a little bit of a mental fog. Yeah. And again, just thinking ahead to be proactive of what your needs might be.
Yeah. a lot of times, what I recall seeing, which is sad, is people coming back in because their doses of medications were changed in the hospital. And then when they got home, they went back to what they were doing before and didn't necessarily align. And discharge paperwork is very hard to understand. And that's why if you've got a friend, a family member, a neighbor, anybody who can be your second set of eyes looking at this paperwork, that's always going to be the safest, because most of the time people have great intentions. Nobody plans to fail, but they get home and they thought they were on one of these pills before, but now the doctor doubled it. They didn't realize it. So now they're putting themselves in harm's way.
And we did and speaking of that second pair of ears, we did a video on what is an advocate, and maybe this is a great time to have that advocate come by before those discharge instructions are read with you, so that there is another set of ears and you have a more clear understanding of what is going on. So,
so Julie, the other thing too is, a lot of times, especially for the Medicare population, and we'll just talk specifically to them, a lot of times for the Medicare population, they qualify for home nursing. And home nursing is provided by home care agencies in the area. Usually people get to pick out which one they want, if they know which one they want, before they leave the hospital. And you should hear from your home care agency within the first 24 to 48 hours of your discharge. But I think what's really important that people need to remember is that under 99.999% of Medicare benefit plans, home care nursing is completely free. It is paid for. And so I have had, in my experience, calling people who've had trouble when they get home. And I said, wow, they didn't send you home with nursing? And they said, oh no, I didn't want that. And when I dug a little deeper, most of the time it was because that they thought it was another expense, another medical expense, and they just really didn't want to dive any deeper into, that kind of hole, if you will. But home nursing encompasses not only skilled nursing, but also physical therapy, occupational therapy, sometimes social work, depending on what the situation is. And so it's a wonderful way. It's added insurance that you've already paid for over the years. Now you're up there, and you need to make sure that you don't end up going back. So don't refuse the home care. It's invaluable.
Right. And a lot of times I talk to so many of my patients that would say, well, they offered home care nursing to me, but I'm good. I don't need it. But they didn't realize their lack of strength. They didn't realize how these normal everyday tasks blew up and became a big thing, just getting to the bathroom, so to speak. And you don't want to underestimate what your needs are. And you can always have a nurse come in, like Kathy said, and they will assess you. You can talk about your needs and what your concerns are, and they will communicate to your physicians as well and determine any concerns that you might have, and you can discharge them when if you decide that you've had enough and you're fine and the nurse agrees with you, or you can just you might just decide that you're okay now.
Yeah, I've had people have home nursing come by, and they do the admission, and they talk to the patient, and they go through their medication, and they make sure they're safe and they have their needs met. And then at the end of the visit, they determine that they don't really need home care or nursing. And so that's the best case scenario. But to refuse because you think you don't need them, it does backfire. And a lot of times we have had to go back and reinitiate those services to people because they found themselves in muddy water pretty quick. So so that's what I
and so talking about the meals and a little bit of resources that might be out there that somebody might not be aware of is, let's say you don't cook your own meals. their home agency, or before you leave the hospital, a social worker or your healthcare team can help find those resources, you know, of where there might be Meals on Wheels, for an example, or some independent agencies like Center of Independent Living or Area Commission on Aging or Area Agency on Aging. And, you know,
There's a ton.
there could be resources out there. So when you get home, you have some additional layers of support, you know.
Yeah,
Um,
absolutely.
Again, just to make people aware that those options are available, and to make sure, another thought that I had, Kathy, is to make sure that there is, like, you have a cane or walker or mobility aids or things that you might need to maneuver
Yeah.
around, grabbers in case you are not able to bend over and you can reach something off the floor. Those kinds of things, you can always ask your nurse or your healthcare team for those as well.
Yeah, yeah. So the goal of this video, and the reason it's important, is that when you get down to brass tacks, this saves you time having to go back to the hospital. Going to the hospital in the first place is a miserable experience, but then having to go back within the first 30 days of discharge is even worse, because your body has not even really recovered from the first hospitalization, and it's taxing and it's stressful. It saves you money because of the obvious, you know, to have to go back and reinvent the wheel again is just like, you know, nobody looks forward to that. And this is the same information that Julie and I have given people time and time and time again who have actually gotten into trouble and called us and said, how do I make sure this doesn't happen again? So you can trust the information we're giving you. We have given this information thousands and thousands of times, and it's good and it's practical and it's easy. It's just making sure that you get your bases covered and not taking any unnecessary risks.
Right. Write anything down and don't forget to ask for help.
Ask for help. Okay.
So, thanks for watching.
Thanks, everybody. Take care.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.